This exercise is going to help you improve internal and external rotation of the femurs and the lower leg while maintaining a stabilized pelvis and upper body. This should help translate stability and better rotational mechanics when walking. For this, I'm using Human Locomotion's twist disc and balance pad. To check out the product, check out the links in the description. Don't forget to subscribe. To improve that, most people have a pattern of rotation that takes them to a rotation of their pelvis that makes their rotation like this, left side to the right. And that causes internal rotation of the right leg and external rotation of the left leg. So what you need to do is strengthen internal rotation of your left leg and external rotation of your right leg. Using the twist disc and the balance pad, we're going to improve our internal rotation of our left leg and external rotation of our right leg. Now, the reason why I have the balance pad here is to help create some ankle strength and mobility and stabilization while you're standing with the twist disc. It also helps kind of elevate you to where your feet are close to the same height, and it'll help you stabilize the pelvis. So the first thing I want you to do when you stand on the balance pad, your left foot's going to go out to a 45-degree angle. Right foot, make sure that your right foot is pointed straight ahead. Don't allow it to turn out to the side. So it's pointing straight ahead. You want to palpate right here on the front of your pelvis. This is your ASIS, so this is the pelvis. Imagine those two are headlights. And if I'm twisted this way, then I'm off to about 25 degrees or so this way. If I'm twisted this way, I'm off that way. So you want them pointing straight ahead. Now, my left foot is turned out, and all I'm going to do is just twist it in, keeping my knee straight. Try not to bend the knee and don't allow the knee to come in past the ankle joint. What you want is standing straight up, look at the horizon, internally rotate that left leg. And internally rotate it to where it's basically straight ahead like the right leg or the right foot. What you don't want is you don't want to use your pelvis to twist it this way. So the pelvis shouldn't be moving at all. It should be straight ahead. Rotate it in. If for whatever reason you can't rotate it in that far, then turn your foot in a little bit so it eases the amount of rotation that you start with, or the external rotation, and then turn it into where it's straight. And you'll feel this leg and this knee internally rotate like so as you do the movement. Now, try to keep your weight balanced on this right foot in the heel, the big toe joint, and the pinky toe joint as best you can. So I internally rotate about 20 reps, and then I stop and come off of it. Now you want to improve external rotation of the right leg. So I switched the balance pad and the twist disc. So now the twist disc is on my right side and the balance pad is on my left. Step onto the balance pad. Now you want to improve external rotation, so you have to internally rotate about a 45 degrees. So you're lining up your toes and your heel at a 45 degree on the disc. And again, if that's too much, then don't start with that much rotation. Make sure that your pelvis is pointing straight ahead, and then externally rotate until the foot is straight. And again, you don't want to use the pelvis to rotate. You want to make sure and keep that pelvis straight. The left foot is going to be balancing on the heel, the big toe joint, and the pinky toe joint. So do about 20 reps. Then you're done. And do 2 to 3 sets of that, or work your way up. If you only can do 10 reps, you'll feel it in the external rotation. You really feel it in the backside of the hip, maybe the backside of the knee a little bit. Just make sure you're keeping that leg straight as you do that movement. On the left leg, you can maybe feel it in the groin, the inside the adductor group, and again, backside of the knee a little bit as well. Do your best to work your way up and progressively do these exercises.